The Telangana government has decided to appeal to the Supreme Court against an order of the Telangana High Court which said that all dead bodies should be tested for COVID-19. This comes on a day when the Telangana High Court in fact slammed the state government on 3 counts. They said, one, that it is not putting out the full information about COVID patients in the public domain. In fact, it's putting out very minimal information, and therefore wanted the government to start publishing how many tests it is undertaking, how many are testing positive, how many people are going through the process, and give also details of what kind of people they are. The second important aspect is about ramping up testing. The court had directed the health authorities to do that, and because they are not doing that, the court in fact questioned whether they want contempt proceedings to be initiated. The third was the issue of dead bodies itself, saying why the Telangana government is in fact not increasing the testing of dead bodies or not conducting the test of dead bodies when the court had specifically asked to do so. But the Telangana Chief Minister as well as the health officials saying that there are about 900 to 1000 deaths that happen every day in the state for various reasons, and if doctors are engaged in just collecting the samples, then they would not be able to focus their attention on giving health care to these people. The second important aspect is that a journalist had died on Sunday, a 33-year-old journalist of COVID-19, and now video has been put out by his brother who was also tested positive, and he was also in Gandhi Hospital, and that video in fact is questioning the kind of care that patients are receiving at Gandhi Hospital, and that has also embarrassed the state government because subsequently there have been also messages put out by the journalist before he died to his colleagues saying that he wants to be shifted out of Gandhi Hospital because he felt that he is not getting adequate care. Perhaps in response to that, the government has said that they have adequate number of beds available there. In fact, the government seems to have found quite a dramatic way of reducing the number of active cases in the hospital that was earlier put at 1771, and now yesterday at the Chief Minister's office it was said that there are only 247 active cases in Gandhi Hospital. What we also understand is that all those who are above 50 years of age and who are asymptomatic were sent home. That number accounted for about 310. Another 83 in fact were shifted to Nature Cure Hospital because they do not have home quarantine facilities or will not be able to be under quarantine at home. And of course there are others who are discharged after the ICMR guidelines that after 10 days if you are asymptomatic you can be sent home. The other important point of concern has been about the health professionals. There have been 153 health professionals who have tested positive, and this includes a big number from NIMS Hospital and another big number in fact from Osmania the Osmania Medical College Hostel, from where at least we understand more than 35 doctors have tested positive. That of course did not come through the patient route. But the third important hospital other than Gandhi Hospital, which otherwise also is a COVID hospital where at least 4 doctors have tested positive, is NIMS, Nizam's Institute of Medical Sciences, from which in fact we have lab technicians as well as doctors from different departments, 5 different departments testing positive, and all those departments had to be closed for sanitization work to be carried out. And yesterday the governor, in quite a morale boosting kind of a measure, she went into the hospital, Dr. Tamilisai Soundararajan, who herself is a medical professional, and she in fact wore a personal protection kit and went into the hospital and told the doctors that they are all the frontline warriors, first line of warriors, and that she is one among them, and that's the reason why she has come there to express solidarity. Dr. Tamilisai has also been saying that there should be increased testing in the state, though she has not directly been critical of the government, but she said that there should be more amount of testing that is carried out. The government has been holding that they are following the ICMR norms, and that they do not think that their testings are inadequate because they are following whatever the ICMR has given as directions. The other important aspect that the government has put out is that they say that everywhere the health professionals are testing positive, and in the state of Telangana it's only 153, whereas all over the country in fact they say there have been as many as 10,000 people who have tested positive, medical staff who have tested positive. 480 got the virus at the AWIMS in Delhi itself, and in the US they point out 68,000 medical staff had got the virus, and in UK 15% of those transmitted who got the virus were in fact medical staff, and therefore they believe that Telangana has done relatively good numbers at least on that count. In other issues, in fact, the Telangana's Chief Minister has also cancelled the 10th class examinations here, saying that because of the coronavirus spread, he is not able to conduct the examinations in Telangana. The exams have already been postponed twice, once in March when the exams were on schedule, and at that time 3 exams had already been conducted pertaining to 2 subjects, and there are in all about 11 exams. They were supposed to restart on the 8th of June and go on till the July 15th, but after the court once again questioned the government and said that exams cannot be conducted in GHMC, which is Hyderabad and Secunderabad, and in Rangareddy, that's when the government decided, in fact, they would cancel the exams overall, and the 5.34 lakh, which means 5,34,903 students will be promoted automatically, and their grades would be dependent on the internal assessments that have been carried out earlier in the schools. Tamil Nadu also, there is pressure, in fact, to follow the Telangana example and to, in fact, cancel the exams. The Chief Minister has also decided on allowing film shooting and post-production work with a limited staff and following the COVID norms, but of course, theatres are not going to be opened as of now, because one, the center has not given any such guidelines, and two, the producers in the state also believe that premature opening of the theatres may in fact prove to be a death knell for the film industry here. In Hyderabad, with camera person Nagaraju, Uma Sudhir, NDTV.